My Community Health Plan by Regina Joseph. My healthcare plan consists of a definition of my community, in which I'll be completing my healthcare plan, a windshield survey, community assessment data generation, community partners and resources I use, my community diagnosis, my community health plan, the interventions for my community health plan, evaluation methods for my community health plan, and a summary. The community that I live in and will be completing my community project on is Laplace, Louisiana. Laplace is one of many towns located in St. John the Baptist Parish. It is a small town located about 25 miles outside of New Orleans. St. John Parish extends on both sides of the Mississippi River. Laplace is one of 4 towns in St. John Parish and is the biggest town in the parish. You might hear me say Laplace or St. John Parish interchangeably because we are often referred to in this area by our parish at times. Laplace is also rich in small business ventures. There's a lot of local businesses in the area. Not too many big businesses. We do have chemical plants and oil refineries here that provide a lot of the jobs in the area. There are not any major department stores or malls in the area. However, we do have a Super Walmart and a Winn-Dixie, which is like our biggest food and clothing chain. We do have a bunch of car dealerships and banks, which in my opinion signifies business growth when there's a bank almost on every corner. Laplace is rich in food culture, and we have been known as the andouille capital of the world. Laplace is also great for small business development and contractor jobs, like I said, the local plants, but it has been negatively associated with people being at a high risk of developing cancer if you live here. Now for the windshield survey, we actually rode around and kind of looked at some areas that define our parish or my town. And I'm going to go through those things in which I found the boundaries here. There is no definite lines, but the levee kind of divides one side. The levee in the Mississippi River, of course, divides one side of St. John Parish from the other. Mostly the boundaries are roads, trees, and then we have Lake Pontchartrain that kind of sits in the back. The houses date back to 1970s or maybe even earlier. Older houses are made of wood and siding, and modern houses kind of have the stucco look with the centralized air. New up-to-date modern houses. There is a lot of open spaces around here, especially along the River Road, Airline Highway, and the interstate. You will see just a patch of sugarcane field, trees, and things like that. A lot of undeveloped land. Common areas, people kind of hang out in the day. I mean, mostly you see business people kind of walking around, going to the store. If they're hanging out, it's probably at the local pool halls, the bar, or the daiquiri shop. It's very popular in this area. For transportation, most people get around using personal transportation. There aren't really too many public transportation systems. You might see occasional independent cab company or a transport company, but they're mainly used to transport medical patients and like senior citizens to the day center and things like that. You might see a few pedestrians walking here and there and some people on a bike, but mostly personal transportation is the mode. The social service centers and areas consist of, you have a range of social service centers for children to adults and mental health. You also have playgrounds in the area, recreational parks, basketball courts, things like that. The residents shop for groceries at the stores one including Walmart, which has closed as well, and there are a bunch of small boutiques locally owned as far as clothing. For food, Winn-Dixie is an option, but we also have two local markets that provide fresh fruits, fresh crops grown in the area, and they serve specialty meats in which you can get them to season it up for you and prepare it a certain kind of way. There are no homeless people noted on the streets at all. You might see stray dogs and cats, but mostly in poverty areas. The condition of the area is well kept. Debris and trash buildup is mostly in the poverty areas where there are abandoned houses, cars there as well. Majority of the population seen is white and black. You may see occasional Hispanic, Asian, and Indian. As far as religion, it's mostly Catholic, Baptist, non-denomination, Protestant, Episcopalian churches seen in the area. There's a huge church on Airline Highway that offers services during times of the disaster, and they are non-denomination. There are other large churches in the area, mostly Catholic and non-denomination. Health indicators, you may see alcoholics hanging around, loitering around a few stores with wine bottles. No obvious indications of substance abuse, other substance abuse. Politics. During election season, you see a lot of campaign signs for local offices. Also here, we don't have a mayor, there's a parish president and a sheriff. You may see support signs for the current president of the U.S. And the area here is also mostly Democratic. There's one small radio station seen in town. Business climate is mixed. There are a lot of small local businesses noticed. There are also several large industrial plants in the area, banks, car dealerships. The restaurants are plentiful. Population density in Laplace is about 1381 per square mile. Population density in Laplace is higher than the entire population density in Louisiana, which have an average population density of 89 people per square mile. The population density in St. John Parish is higher in Laplace than any other town in the parish. In some areas in Laplace, the population density is as high as 8,862 per square mile. Population in Laplace is 34,101 according to the Census Bureau of 2010. Blacks and African Americans make up 48.2% of the population, which equals to 16,433 people in St. John Parish. And in St. John Parish, the total population is 45,924, in which blacks make up 50% of the population, equally to 24,576 individuals. Whites are the second largest group in the population, accounting for 19,501, which is 45% total in St. John Parish, and 47% in Laplace. St. John Parish is not the largest diverse parish, but there are a few Latino, Asians, Americans, and in the areas, and they only account for a small percent of the population. Community assessment data. Now, although there is no recent data on the leading causes of death in St. John Parish or Laplace at this time, in Louisiana, heart disease is the leading cause of death, with taking out 10,665 deaths per year, ranking 5th in the nation. This is according to the Centers for Disease Control and Prevention. This data to me is significant considering Louisiana is one of those states in the South located in an area nicknamed the Stroke Belt. Louisiana, especially New Orleans, we are famous for fried food dishes and high salt contents in the seafood. Now, cancer is the second leading cause of death in Louisiana, with 9,397 deaths per year. The river parish alone is nicknamed Cancer Alley because of the numerous amount of chemical plants concentrated in one area. If you ride along the river road in St. John Parish, you will catch a chemical plant all the way down. You'll get a few gaps in which you'll see houses, and then in return, if you're riding on airline, you'll see chemical plants in those areas. The Environmental Protection Agency is currently investigating high levels of chloroquine, which is a carcinogenic agent, in the plants at a plant called Dinka Chemical. The community partners that I work with are Ms. Daphne Davis and Henry Joseph. Daphne Davis is the Director of Nursing at the St. John Parish Health Unit. The health unit provides free immunization and healthcare visits for low-income families. They provide prenatal care, family planning, and STD testing for those in the community. The health unit and the website also post information about any dangers that are known in the area to help families prepare and create action plans. Henry Joseph, who is my father-in-law, he works in the parish office in the Public Works Department. He is knowledgeable about the conditions of the parish through his work and contacts in the community. He helps keep individuals informed of dangers and upcoming events in the parish. He is also available to provide information on appropriate contacts in the department heads in the parish office on who to talk to for what. The other two resources that I use that are available in the parish were St. John Parish included the the Baptist Parish website and Destiny Christian Center. The parish website provides information on what's going on in the parish. The website updates the community on issues found in the water supply, environmental safety concerns, as well as provide information on council members and their contact information. The parish website is a great resource to use to stay informed of any situations that may happen in the area. Destiny Christian Center is the church that I attend. They provide information on community updates, resources, and information services that may be lacking in the area. The parish officially usually keep the churches informed of any crisis and all other situations that may arise in the area, and the church relays the information to the congregation and provides services when and if needed. My community health diagnosis and health plan. The diagnosis is risk of altered health maintenance or ineffective airway management among the residents in the parish of St. John the Baptist, related to knowledge deficit of the amount of harmful chemicals being released from the chemical plants and multiple chemical plants in a concentrated area emitting unknown amount of hazardous chemicals into the air daily. Our health plan is to educate the residents of St. John Parish or LaPlace on the effects of hazardous chemicals being released by chemical plants and the requirement that plants should follow according to government regulations to encourage residents to force the chemical plants to comply with EPA standards on the minimal amounts of chemicals to be released daily according to the Clean Air Act. Educate the residents of St. John Parish on ways to communicate with parish officials and state representatives about the concerns of the community. The interventions for a community health plan includes assessing the community's current knowledge of the current health risks associated with the hazardous particles released in the air by the chemical plants, to assess the community's need for additional information, to assist the community with resources on where to find current data on what the chemical plants are reporting and what are the requirements by the EPA and Clean Air Act. To plan the interventions are for the community nurse and community partners to assess for current health issues of community members by asking questions and having members complete healthcare questionnaires. to give community members access to submit forms through public health office, mailing in questionnaires, or through links on social media. Another intervention is to assess the community's ability to maintain health and seek medical help for any current health issues or concerns, to assess or for access to doctors and practitioners in the area. Community leaders, partners, and community nurses will access current health community reasons for not seeking health care. Interventions for community health plan. Assess the educational levels of community and community makeup, including barriers to learning, age, culture, and language barriers. Provide information in different languages to reach the different diversities in the area. Provide simple and easy to read information. Provide educational information about the air quality in the area and the requirement demanded by the EPA Clean Air Act in audio form on parish websites. Notify community members of ways to access the information. Community nurse and partners provide educational material on the resources in the community, including transportation services for medical visits and access to healthcare services. Provide information on financial resources available to those in need for any medical services needed. Community nurse and partners will provide information on who and how to contact community leaders, state representatives about community concerns. Community nurse will partner with local government and healthcare department and provide free diagnostic screening during community health fairs provided semi-annually to residents in the St. John the Baptist Parish community. Community nursing partners will create a social media page that update the community on the latest developments on the chemical plant's compliance with EPA regulations. Social media page will notify community residents of upcoming meetings. Social media page will serve as a year-round resource to obtain information on the latest air quality testing and any response from state representatives and local councilmen. Information will be given through a series of meetings held for 1 month where handouts will be provided on resources in the community. Evaluation for a community health plan. Evaluation will be measured by assessing the knowledge of community for information learned through community forums. Overall assessment of knowledge will be obtained by providing surveys to community members to assess for learning of the conditions of the community. Community nurse and community partners will monitor for increase in use of parish websites. Community nurse and partners will monitor use and responses posted on community social media page. Community nurse will monitor attendance of community health fairs offered by the community. Community nurse and partners will assess and monitor for increased involvement in community talk and demonstrations regarding the compliance of local chemical plants to EPA standards. In summary, the major health concern at this time in St. John the Baptist Parish on the Platte is related to the hazardous chemicals released in the air by chemical plants daily. As a resident, community health nurse, and advocate for those in my community, we can eliminate and or reduce the health concerns in the area. Educating and informing the members of the community of the hazards we are facing and helping them to locate resources and push for changes in policy, we can therefore increase the health of those in our community.